There you go. Okay, so I'm going to be demonstrating how to prime the PCA administration set for us. The first step is to get your PCA tubing. I don't know if you can zoom in on that. This is our tubing. It is considered a Y connector. It is on our PACU administration or PACU supply cart. It should be on the right hand side with all of our other tubings. You're gonna need to grab this. Obviously our medication from pharmacy. PCAs are usually Dilaudid or morphine. If it is a morphine PCA, it will be located in our Pyxis in the PACU. If it is a Dilaudid PCA, we will have to obtain it from pharmacy. We might have to go down and get it, or they will tube it up to us, and then we're gonna need a 10 ml syringe. So for educational purposes, I did try to dye our medication. As you can see, it's leaking just a little bit because I don't have the cap on it. But just so you can see how far exactly I'm gonna prime in the tubing to show that differentiation. The tubing has also already obviously been opened. There's not caps on it, but when you do pull a brand new set, you'll have to open it and remove the caps. So just a disclaimer there on those differences that you're going to be seeing in this video versus what you'll be seeing when you're actually doing. So the first thing you're going to do is obviously take your tubing out, and I want to show you what I'm talking about when I'm talking about that Y connector port. That Y connector port is right here. This is actually where your fluids will connect to this port. This end hub will connect to your patient, and the top of the hub will connect to your medication. So the first thing that I'm going to do is obviously I'm going to connect my medication here. And what I want to do is prime this line all the way down to the bifurcation piece and just a little bit past. I want to give you that rationale of why. Two reasons. Number one, if I prime this medication all the way to the end of the tubing and then flush, I'm actually wasting a pretty significant amount of narcotic that really shouldn't be wasted. The patients obviously get charged for this. They keep a very close track of the medication along with the mLs. So I want to make sure I'm not wasting it. The second reason I only want to prime it to here is if for some reason we don't flush all the way through, there's a potential for you to be bolusing your patient a huge amount of narcotic and not even realize it. So best practice would be to go ahead and prime this tubing, again, just past this little bifurcation point. So let me go ahead and do that. It's coming. So again, my liquid is just right here. I don't know if you can see it. It's kind of filling this. I tried to color it, but it's not coloring as significant, but I just primed it right past here. I'm then going to be taking my 10 ml flush, and I'm going to be attaching it to the Y port, and I'm going to flush the rest of the way through with saline. So I know that there's no narcotic, it is all saline. I will then clamp it off. We are now primed and ready with our PCA tubing. Again, the end of this tubing is going to connect to the T-piece of your patient, and your fluids will connect exactly where your flush is located, and then you can tape kind of that bifurcation down. And that is how you prime our PCA tubing.